Another committee that I initiated was, we call it IDOC, Infectious Disease Outbreak Committee. It was, to be honest, it was even put up before the COVID pandemic happened, all right? It stemmed from my previous experience in another hospital where this particular committee serves the function of preparing the hospital for pandemic, get the whole hospital effort, right, from the clinicians, all right, the nurses, the doctors, the allied health, pharmacists, to the support staff like security, HRs, etc. Everybody together to say that we need to plan for possible pandemic. All right, that includes designing workflows. All right, that includes horizon scanning to say what are the impending infectious diseases that may affect us. In fact, for us, what is very interesting is that while we are discussing about it, right, then COVID happens. Right. All right. Then we realized there is a lot of rooms for discussion, right? Then it became quite important. And what we do realize is that when the hospital was designed, it was designed without pandemic management in mind. It was designed with the view that we are not going to be the main pandemic management hospital. The scale of the outbreak was so big that no hospital can say that we are not pandemic ready. Yeah. And because of that, you know, our discussion evolved around how do we deal with pandemic with this new hospital design that was not originally meant to do so. And that actually went through a difficult time of trying to make a lot of infra changes. As you know, every infra change is number one, costly, and number two, time consuming. So there is a lot of balancing that is required between how do you make the new hospital the next COVID pandemic type ready versus how do we open it on time, and if so, what are the infra that we can insist on, what are the infra that we can live without with mitigations in place. And that is where the IDOC committee became important, where we actually sat down to discuss what are the good to have, what are the must have, what are the non-negotiable, and what are the less critical, that for the pandemic management.